What health challenges or conditions brought you to explore stem cell therapy?
I had herniated discs. I had 3 of them. It really got to a very uncomfortable point back in 2005. I think on a pain level of 1 to 10, I was doing somewhere in the 7 to 8s. And I did that for like almost 14 years, where I tried every treatment out there. Anything you can think of that might give me some kind of relief, I tried. I'd gotten to the point where I was considering surgery, even though buddies that are surgeons were telling me don't do it, don't take the surgery. And then I ran into a guy named Kelly Zimmerman, who talked to me about stem cells. And I'd already done some research on stem cells. I just didn't know where to go to get them. I'd noticed a bunch of athletes, when they were injured, went and did stem cell, and then all of a sudden they're back on the court. And I thought, well, if they can do that for them, they might be able to help me with my back. So I started looking around, ran into Kelly, who was a retired fire captain for Orange County Fire. And he probably took an hour and a half explaining stem cells, how they work, what they do, the whole procedure, and made me comfortable. And then I continued to do some more research for about another 2 months before I got there.
And how long ago did you have stem cell therapy the first time?
It's been 3 years.
It's been 3 years.
Got off the table out of pain. I had an IV of 300 million stem cells, or thereabout. They did an ozone gas treatment. So they injected ozone gas into each of my discs, all 3 of them. And then they put in 25 million stem cells in each disc as well. And those were just direct injections.
So what made you finally do it? What level of pain? What made you finally do it?
It was a combination of things. So I think that the pain side, I had gotten to the point where I didn't care if I lived or not.
Oh my God.
I wasn't gonna do anything myself, but if I wasn't here,
there was no joy.
I was like, well, at least I'm out of pain.
Yeah.
And that's a really sad place to be. Talking to Kelly, he gave me the confidence to know that 1, this worked. 2, he had done it. So I now know people that have physically done it that had same issues I had. And, at that point, it was just money.
Can you tell me a little bit about your flight home from after you had the stem cells?
Yes, absolutely. Well, let's just say I was in pain when I went.
Sitting for 5 hours on it, or
absolutely.
3 hours on an airplane.
And I'm always having to scoot down, if you will, to take the pressure off my back. In fact, the first day I got it, I went back to the hotel, slept, went to dinner. And about 30 minutes into dinner, I noticed that I was still sitting straight up and that I didn't feel any pain. All that pressure that I used to feel was gone. The first day, that first night, I got up in the middle of the night to go to the restroom, and I got halfway to the restroom and I thought, holy crap, no pain. Literally did stem cells in the very beginning. I felt amazing afterwards. Not only the back pain was gone, but everything in the body kind of lit up, and it felt really good. And I felt really good for about 1.5 years, maybe 2 years. If I have any pain, it's a 1. And it's not pain.
Not an 8.
Yeah, it's not pain. It's just
soreness.
Stiffness. Yeah. I mean, I went on a driving range with my son. Hit balls, 2 buckets of balls, stiff, but no pain.
You're just using different muscles
That's
too.
all. Exactly.
Yeah, exactly.
Using different muscles, exactly. So that's my part about relearning what it feels like to be normal, because I haven't been normal for a long time.
Right.
So what brought me back down here was to basically re-inject these stem cells in my body, knowing it's going to make me feel better, knowing it's going to take care of any little, things that are feeling off. It just makes you feel really great when you do it.
What would success of today look like?
Yeah, so I got lots of trips coming up where I'm going to be mobile. I have arthritis. I was an athlete in college. I swam for a living, so my shoulders hurt, my elbows hurt from swimming, my knees hurt occasionally. All that's going to go away. I know that for a fact. There are also things going on in my body that I'm not even aware of, that I know is going to be taken care of. So that's the main reason to come back down. I've done this already. I know it works. I know how I felt, and I'd like to feel like that again.
You look very fit. Do you feel like since you had the first round of stem cells, has that at all motivated you to stay as fit as you look as of today? Because you don't look your age, not that 63 or 66 is older, but
Yeah.
you definitely look fit.
Well,
Have you always looked this way?
Yes.
Okay.
I appreciate that. And I don't want to look any other way. So I do what is necessary to stay there. Now, with that said, do the homework, talk to somebody. I run into people all the time that knew I had back issues. And a lot of times the first time I see people I haven't seen in a couple of years, how's your back? Because everybody knew. And then when they have issues, I encourage them to call and speak with someone that does stem cells and get the knowledge that they need to understand whether this is going to help them or not. If they tell you it's a possibility, roll the dice.
Yeah.
Because it's going to make all the difference, especially if you're in like chronic pain. It's huge. I got off the table out of pain. Now, I did have PTSD months later because it was like, oh crap, I don't want to go back there.
Into pain, correct.
So, I kind of took it easy for a while, but now that I'm stretching out a little bit and knowing that I can swing 2 buckets or swing clubs on 2 buckets of balls and walk away from that with no issues, yeah, I'm going to stretch and, play pickleball, get back on the racquetball court. Travel.
Walk
yes.
miles a day.
I'm looking forward to, one of the reasons I'm actually here is I'm looking forward to not having any challenges with travel. And there's an energy level too that comes from stem cell. I mean, I was excited about life again and, just kind of buzzing around.
So just the last question, is there anything else you want to share? Now, this is prior to you going in and getting your infusion, but is there anything else that you'd want to share with anybody that might be in a similar situation?
Well, let's do it this way. I'm budgeting for every 3 years to come back.
Perfect.
Yeah, especially at 66. Things start to deteriorate over time. It's just a natural process. But if I can stay healthy and, pick up another 10, 12, 15 years, why not?
Oh, I think you got another 30, 35 years in you, dude.